Without context, numbers appear chaotic, as erratic as a gust of wind. Without context,
High alert for pneumonia outbreak in the city of Wuhan.
Numbers like 48 and 60 mean little, but give it a moment, because soon enough they will.
Coronavirus.
10 days after the Centers for Disease Control warned U.S. doctors of an outbreak of pneumonia in Wuhan, China, the CDC tested its first patient.
Global concern about
This new coronavirus strain
is to detect this virus early.
It found its first case 3 days later.
A man in Washington State.
In his 30s.
When a test found it in Washington State.
First confirmed U.S. case of the contagious coronavirus.
Following day, the president,
We have it totally under control.
appeared unfazed.
It's going to be just fine.
And day after day after day, all was fine. Until one day, someone suggested maybe it wasn't.
We don't know the accuracy of this test.
Not that it stopped an anxious CDC from sending those tests to various state labs, but there was clearly a problem. Supplied with the new kits, states managed to test no more than 1, 0, 3, or 2 samples per day. Finally, by mid-February, the CDC admitted
they were getting indeterminate answers.
The tests it had sent states had not worked well.
So we're taking a little extra time here.
Flawed results stalled testing nationwide. 69 samples tested, 63 samples tested. By the time the CDC remedied the problem with the tests, the president suggested the low case counts were a good sign.
So far, we have lost nobody to coronavirus in the United States.
The next day, nobody turned into 1.
Tragic news.
Now the first U.S. death.
It was a male in his 50s.
This is still rapidly unfolding.
Then 1 turned into 6, which turned into 14.
Anybody that wants a test can get a test.
Context. In a country of more than 327 million, that day, the 48th day of testing, little more than 2,900 had received a test. Little more than 2,900, less than 1/100th of 1% of the country. Context. In 48 days, the U.S. had managed to test, on average, roughly 6 people per day. As patients sought limited testing, cases doubled every 2 days. 400, 1,300.
Now have the capacity to test up to 75,000 people for COVID-19.
That day, the U.S. had tested roughly 6% of that number, roughly 5,000 in all tested. Deaths remained rare, 43, 51. Yet that day,
That is a failing.
And a failing, yes.
It is a failing. Let's admit it.
Dr. Anthony Fauci finally said what anybody who wanted a test already knew.
The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that. Do I think we should be? Yes, but we're not.
The following day, 1,300 positive cases and at least 55 deaths.
We therefore expect up to 500,000 additional tests will be available early next week.
It would take another 13 days for the country to test 500,000. 13 days of more cases and a rapid increase in deaths. 100, 200, 400, 700, 1,200. By the time the country tested 500,000, the country had confirmed more than 86,000 positive cases.
We're just learning about this for the first time.
A statewide order for people to stay at home.
And by the time the country tested 1 million, more than 3,800 were dead.
The death toll is rising.
We are in the surge, yes.
Context. During the first 48 days of testing, the country managed to test roughly 6 patients a day. More than a month later, we are still trying to understand the ramifications of that, at a time when even now, anyone who wants a test still can't get a test.